Do you have prolapse or a history of heaviness or pressure in your pelvic floor? You might have a lot of questions about this, and this might create a lot of fear in your life. So the goal of this video is to explain what is prolapse, how it may affect your life, and how physical therapy can help. My name is Leah Lee. I'm a pelvic floor physical therapist. Today I'm going to discuss what is prolapse, how it can affect your daily life, and how physical therapy can help. What is prolapse? Well, your pelvic floor is a group of muscles that sits within the bowl of your pelvis. So sit in the basin of that, and they support the organs that sit within your pelvis. So sometimes with prolapse, what can happen is these organs start to descend down towards the vaginal canal. The prolapse can occur from the front wall of the vagina, and that's from the urethra and the bladder. It can occur from the top, from the cervix, or from the back where the rectum is. Prolapse is graded on a scale of 0 to 4. 0 is no prolapse present. 4 is the most severe, when the organ is protruding out of the vagina. Common causes of prolapse may include pregnancy and childbirth, pelvic floor overactivity, or the pelvic floor muscles really can't turn off, and that's been going on for a long time. Chronic coughing, such as with patients who have COPD, people with previous pelvic surgeries such as hysterectomies, or even weightlifting where you aren't incorporating proper breath patterns into your lifting. All right, so how can prolapse affect your daily life? It can affect it in a lot of ways, but a lot of symptoms that you might feel if you do have prolapse include the feeling like something is falling out, or feeling of a lot of pressure or heaviness through your pelvic floor, especially that worsens as your day goes on. This may also include low back pain that worsens as your day goes on. It can include constipation and incontinence that can also be associated with prolapse. Prolapse can cause a lot of fear. People often avoid activities they love because they fear it's going to make their prolapse worse, or that they're not going to be able to complete their workday or their exercise routine without that heavy feeling of pressure or worsening of your prolapse. How can physical therapy help with prolapse? First off, an internal examination would be very helpful by a pelvic floor physical therapist to examine how's your pelvic floor muscles functioning? How are they supporting you? Are they doing what they need to do to be able to support the organs within your pelvis? So can they contract? Can they relax? What's the tone of the muscles? What's your posture like? What are your lifting mechanics? Even on a daily basis, are you able to perform different lifting activities, such as pick up something off the ground even, with proper mechanics and proper coordination of a pelvic floor muscle contraction with your breath? That's really important for the function of your pelvic floor. Another thing is we'll discuss different diet changes that might be helpful to incorporate, such as reducing the amount of irritating foods or liquids that might be irritating to your pelvic floor. So overall, with physical therapy, we want to really just tailor your treatment to you. So it's person dependent. It depends on what you specifically need. We'll see what you need and we'll help you through it. Now I hope you know more about prolapse, what it is, and how physical therapy can help. For a list of some do's and don'ts that can help you manage your prolapse, click the link below.
If you found this video helpful, be sure to give it a thumbs up, and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.